Welcome back to the broadcast. Well, a recent medical review has linked multiple rounds of antibiotics with an increased risk of obesity in toddlers. Some doctors think this is because antibiotics can cause a change in normal gut bacteria. Also, antibiotics are commonly overprescribed. Joining us to discuss this topic is Dr. Jane Sadler from Baylor Medical Center at Garland. Good morning. How are you today?
Good morning. I also have allergies, but
don't we all?
I don't sing.
So we were chatting up a little bit earlier this morning. I've got two kiddos, 6 and 9. Both had numerous ear infections when they were younger. It was almost to the point where I'd go into the doctor's office and say, forget all that other stuff. I want the Omnicef, which is like the big boy of antibiotics. And you're telling me that is awful. And explain to me why that is so bad for our kids.
Well, it isn't awful. It really isn't awful. When kid needs an antibiotic, the child needs an antibiotic. The problem is antibiotics are overprescribed. And now we know that especially in infancy, say 0 to 6 months of age, children who were prescribed 2 or 3 rounds of antibiotics were at higher risk for obesity. In fact, 20% increased risk for obesity. Now, the antibiotics didn't include your penicillin, amoxicillin that are standard antibiotics, but what we call the broad-spectrum antibiotics, like your Omnicef. So we really need to encourage patients and physicians to have different expectations about antibiotics when they go to the doctor's office.
So if we need to be worried about these things, you know, I think about when my babies were little and how miserable they were because they were suffering. Stuff like amoxicillin wouldn't work, and they had been sick for 2 or 3 weeks. What should parents do to try and avoid getting on those big antibiotics like Omnicef?
Well, you first have to be honest with the doctor. If your child isn't having high fever, 100.4 or higher, 99 is not a fever.
Right.
Then you really need to tone down your level of of concern and pressure. Because sometimes as physicians, we feel pressured to get an antibiotic because the parent is worried, concerned, and the child is, unquestionably is ill. And we're afraid, certainly, that the child could get worse. But with close monitoring and a really good doctor-physician relationship, close connectivity, a lot of times we can hold off that antibiotic.
Don't you think it's hard these days, though, to really build that connection with doctors? To me, I think that's one of the things we're missing in healthcare these days, is really being able to grow that connection. What sort of advice would you have for parents trying to seek out that connection when people are, just filtering patients through the office? And it really is so important in caring for our kids.
Well, the first thing you can do is when your child becomes ill, go to your doctor. There are several clinics where they're seeing, tens, hundreds of patients, and so everything has to
Lots
go
of
really
those
quick.
urgent care clinics popping up all over this area.
Right, and they're run by very good physicians, but it's so much easier as a doctor to just prescribe an antibiotic than it ever is to explain to concerned parents that their child does not need an antibiotic. 10 million antibiotics a year are overprescribed, according to the American Academy of Pediatrics.
And of course, there's some resistance issues coming up now, right? We hear a lot more about MRSA and other things that are actually resistant to some of these antibiotics that normally should maybe help out a little bit.
Yes, in fact, we're going away from your broad-spectrum Omnicef, and we're going back to the old and original antibiotics such as amoxicillin, penicillin, Bactrim, the sulfa drugs, and you'll see that a lot in our prescribing.
Well, tell me a little bit about this obesity link and what parents can do about the gut connection. I've heard a lot about that. I've done a lot of research on it. Do you give probiotics to your kiddos? What do we need to do about this obesity link?
Well, when your child goes on an antibiotic, I really try to remember to get the parent to give the child a natural probiotic. And when I say natural, I don't mean a synthetic pill, something that's more natural, that's better absorbed, like a yogurt. Kefir, K-E-F-I-R, is a wonderful drinkable probiotic that's available in the yogurt aisle. These things can help alter the gut bacteria. We think that it's the gut bacteria change as a result of the antibiotics that may promote obesity later on. It was interesting, last night I was reading a report, came out August 14th of this year, that they took gut bacteria from obese mice and who had been on antibiotics, and they put it into mice that hadn't been exposed to antibiotics, that same gut bacteria, and those mice or rats that had that gut bacteria from the obese mouse did in fact become obese.
Oh my goodness.
So it really links that gut bacteria towards obesity. Now, obesity is not just gut bacteria.
Sure.
There are multiple factors.
Well,
that cause
Doritos
obesity.
and French fries and chicken fingers, right? But it's interesting about this whole gut connection to everything, really with the inflammation in the entire body that can result from that inflammation in the gut, right? And that's kind of something that gets our immune system all sort of out of whack. I've heard a lot about that.
Well, it's the gut bacteria that affect the absorption of certain nutrients. And we think that is really the factor that plays a role in obesity.
Wow, this is all so interesting. So if a child needs antibiotics, what's your end of the day recommendation?
Well, if they need the antibiotic, give them the antibiotic. But at 6 months of age and less, it's really critical that the child be evaluated very closely because those kids don't have a great immune system yet. But we definitely need to have a longer conversation with the parent regarding the necessity of antibiotics. And if we can delay the use of the antibiotic, wait a few more days, call the parent, and check on the baby, then maybe we can decrease the use of the antibiotics in children.
I love this. Great information. Thank you so much for that. We appreciate you being here.